About half of the patients with Parkinson's disease may feel low or they may feel depression. And sometimes these symptoms could be milder, such as lack of interest or lack of initiative, or these patients lose the assertiveness like a normal person. The majority of the patients with Parkinson's, they have a mild chronic depression, sometimes referred as dysthymia, and a fair number of patients may develop major depression. These patients may also have fatigue, irritability, lack of energy, indecisiveness, and sadness. The physicians, as well as the patient and caregivers, they should work as a team to be vigilant about these signs and symptoms of depression. And these symptoms should be identified, as well as any life stressors which could be responsive for depression should be identified. Strategies such as daily exercise can help with depression. Engaging in more social activities, staying in touch with friends and colleagues is also helpful. Seeing your children frequently and relatives is of course helpful. Reading more interesting material, joining a Parkinson's support group, and doing things which are of interest to someone and not quitting them is always helpful. Patients should also try to develop a sense of humor or hobbies such as gardening or participating in an adult daycare program and activities. Getting involved in the community is helpful. Not living alone, of course, is helpful. Living with their children or spouse or friends always improves one's morale. You should try to speak for yourself and don't let others speak for you. Also, avoiding alcohol and other drugs can be helpful. Decreased motivation could be a symptom of depression, and these patients may develop a difficulty to make decisions. And sometime when you ask them to decide something, they may be looking towards their spouse. So mental stimulation is important in these patients.